Trumpcare in 3 words. Fuck the poor. Fair warning, this will be a ramble in the truest sense of that word. I have some thoughts on the Republican proposal to replace the Affordable Care Act. Those thoughts are loosely related to one another because they all pertain to the Republican health plan, but they're not terribly well organized. So let's just start barreling down this road, shall we? And we'll start with, what do we call the Republican health care plan? What are we supposed to call it? Because its official name is the American Health Care Act, but a lot of people are calling it Trumpcare, and the Republicans don't like that. In fact, last week there was this story on Politico with the headline, "White House, don't call it Trumpcare," subheading, "Critics are hijacking the branding process for the GOP health plan as the White House resists slapping the president's name on it." And further down into the article, you see a quote from Kellyanne Conway from an appearance on Fox News where she says, "I'll call it Trumpcare if you want to, but I didn't hear President Trump say to any of us, 'Hey, I want my name on that.' We're happy it is the American Health Care Act. This is serious stuff. This isn't about branding according to someone's name." A White House spokesperson, however, was more emphatic. "It's not Trumpcare," the spokesperson said Wednesday. "We will be calling it by its official name, the American Health Care Act." Well, you know what, White House spokespeople who don't want us to call it Trumpcare, when you all start referring to the Affordable Care Act by its official name, maybe we'll start referring to Trumpcare by its official name. And until that happens, go fuck yourself. How dare you Republicans spend the last 7 years attempting to delegitimize the Affordable Care Act by not only lying about it and telling everybody that it was a failure when it wasn't and it isn't, but also by attempting to tie it with the president that you also spent his entire administration trying to undermine and delegitimize and vilify. And see, then he really pissed you guys off because he reappropriated it. He said, "Go ahead, call it Obamacare. I think it's great. You want to name it after me? Go ahead." And see, that really got your fucking goat, didn't it? So you know what? I'm going to call it Trumpcare because that's what it is. I'm not going to take it seriously. I'm not going to give it the respect that you want me to give it because you never gave the Affordable Care Act the respect that it deserved or President Obama the respect that he deserves. So how dare you come out and say, "Oh, no, don't call it Trumpcare. This is serious business." Go fuck yourselves. But now that we know what we're going to call it, Trumpcare, let's talk a little bit about what's actually in it. Or rather, what's not in it. Here is a Washington Post article from last week, headline, "Obamacare repeal guts crucial public health funds," which describes how Trumpcare would eliminate funding for the Prevention and Public Health Fund, which, among other things, provides about $1 billion of annual funding to the Centers for Disease Control, which amounts to 12% of the CDC's total budget. So if Trumpcare becomes law and this provision is in that law, it's 12% of the CDC's annual budget just dropping right out of the bottom. 12% of its annual budget is just gone. And what that means is less money for the CDC to carry out the incredibly important programs that it is responsible for. For instance, the CDC's former director quoted in this story, Tom Frieden, says that if the prevention funding is lost, quote, "Americans will be at a greater risk from vaccine-preventable disease, foodborne infections, and deadly infections contracted in hospitals." So this healthcare plan proposed by Republicans that is supposedly going to be so much better than the Affordable Care Act, and it's all about saving lives and protecting Americans. It's going to cut $1 billion a year of funding from the CDC, funding that goes to research, that goes to disease prevention, that saves people's lives and helps us to deal with outbreaks of disease as best we can. We're gonna save money by eliminating that, right? That's a great idea. That's a great plan. That's really going to help a lot of people. Let's see what else is not in Trumpcare. And this one, this is peak Republican right here. Check this out. The act will cut federal funding for Planned Parenthood, and that's not all it will do, but let's just start with the Planned Parenthood bit. It will defund Planned Parenthood by blocking Planned Parenthood from benefiting from Medicaid reimbursements. And that makes up a majority of the federal funding that Planned Parenthood receives. It's worth mentioning that blocking Planned Parenthood from receiving Medicaid reimbursements will not prevent a single abortion, because federal funds are already blocked from being used to pay for abortion services. All this will do is prevent low-income patients who predominantly go to Planned Parenthood clinics for the medical care that they offer from receiving that necessary medical care. Stuff that has nothing to do with abortions. Lots of women and men as well, by the way, receive all kinds of medical services from Planned Parenthood clinics. And by blocking Planned Parenthood from Medicaid reimbursement, a major source of their federal funding, you are essentially stopping all of those people, predominantly low-income people, from benefiting from the medical care that they rely on Planned Parenthood clinics for. So, as I said at the beginning of this video, the plan amounts to fuck the poor. But back to abortion, because lest you think that the Republicans haven't also found a way to specifically fuck people who want abortions. They found a way to do that too. They're going to cut funding to Planned Parenthood clinics, just in general, right? And they're going to exempt private insurance plans that cover abortion services from the federal tax cuts that they're offering in their new plan. Check this out. It threatens to dismantle the entire private insurance market for abortion coverage, not just public funding for abortion providers. If a woman wants a health insurance plan that will cover abortion, she and possibly her employer won't be able to use tax credits to buy it under this bill. And if this bill passes, there's no guarantee that women will have any good options for private insurance coverage of abortion, a procedure that out of pocket can cost from $500 for an earlier abortion to tens of thousands of dollars for a later one. The bill could effectively eliminate private insurance coverage of abortion. So when President Trump said during his address to a joint session of Congress recently that the Republican replacement for the Affordable Care Act would preserve a patient's right to get the health care that they needed, but it would enable them to get the health care that they want, he was, and I know this is a huge shock to a lot of people, lying, because that did not include women who want a health plan that covers fucking abortion services. If you're a woman and you want a health care plan that covers abortion services and this bill goes through and becomes law as it currently exists, you're shit out of luck. You can't use the tax credits that you could otherwise use to help you pay for your insurance plan to pay for any insurance plan that includes abortion in its covered procedures. And if you're an employer and you offer insurance to your employees, you're probably not going to even offer plans that include abortion coverage because you know that you're not going to get any federal help paying for it. You're not going to be able to afford it. Your employees aren't going to be able to afford it, so you're not even going to offer it. And heck, friends, it might just be eventually that private insurance companies just stop offering plans with abortion coverage altogether. This is the kind of shit that people are talking about when they say that the Republican Party is conducting a war on women. When Republican politicians will grunt and groan and shake their heads and say, we don't have anything against women. And then they do shit like this, where they not only try to block funding to Planned Parenthood, not just abortion funding, but funding in general to Planned Parenthood, to fuck over poor women who go to Planned Parenthood to get medical care. But now they want to take it a step further and completely eliminate abortion coverage from the private insurance market. And yet they have the balls to say that they're not anti-woman. Fuck every goddamn one of them. But that's not all. That's not all. There's even more to talk about in Trumpcare. Check this out. Staying with the theme of how Republicans say that they don't hate women when they totally do. Last week there was a meeting of the House Energy and Commerce Committee where they were debating Trumpcare, and a Republican representative from Illinois, John Shimkus, was discussing some of the procedures that are mandated to be covered under the Affordable Care Act, one of those procedures being prenatal care. And Shimkus said, well, that's not fair. Why should men have to pay for prenatal care? Men don't need prenatal care. And this is by no means a new objection. Republicans have been pissing and moaning about this for years. Why should men have to pay for women's health care? That's not fair. And this is a little bit like saying, why should my taxes be used to pay for the upkeep of roads I don't even drive on? I only drive on a couple of these roads, but the state takes my taxes and they use little tiny pieces of my taxes to upkeep all of these other fucking roads that I never even drive on. That's not fair. Spend my tax dollars on the roads I drive on and let the other people who drive on those other roads pay for their own roads, because that's how that works. It's a similar concept. You realize that the health insurance industry is being governed and controlled and changed by people, many of whom evidently have no fucking clue how insurance works and can't be bothered to take 5 minutes to fucking figure it out. You don't have to be an expert on it to know that in an insurance pool, a health insurance pool, the people who are at low risk, the people who don't need as much medical care, are the ones who help to subsidize the people who have higher medical costs. Everybody pays for insurance. Everybody throws into the pool so that the people who do need to call upon their insurance coverage more often, who do need more medical care or more expensive catastrophic medical care, can get access to that necessary care, and it won't be as expensive because everybody's paying into the system and everybody is covered. That's how that works. It doesn't matter if a man will never get to use prenatal care. You might be a healthy person with a good heart and you will never need to pay for open heart surgery. It doesn't matter. Everybody pays for everything because everybody might not need to use every single procedure, but every single procedure will be necessary for somebody. So it's good that they're covered, right? Right? I mean, are we talking about saving people's lives? Are we talking about affordable access to quality health care? That's what everybody says we're talking about. It doesn't seem to be what Republicans actually care about. Let's move on, shall we? This next one you've heard about, but let me just go over it again. There's another Republican representative, Jason Chaffetz, who appeared on CNN last week and was asked what Trumpcare would do to help low-income Americans. And he said, you know what? Americans have choices, and they've got to make a choice. And so maybe rather than getting that new iPhone that they just love and they want to go spend hundreds of dollars on that, maybe they should invest in their own health care. I'm going to have to tell another Republican to go fuck himself in this video. Representative Chaffetz, you can go fuck yourself. And so can every other Republican over the last 8 years who has talked about buying health coverage as though it is in any way comparable to buying a phone or some other consumer product. Spoken about patients as though they're consumers. We need to educate people to be smart consumers in health marketplaces and spend their money wisely when they're purchasing health coverage that they need to live. Because obviously that's what you want to do if your number one concern is patients' health and quality of life. If the number one thing you care about is giving people affordable access to quality care, you're going to want to treat the whole thing like a marketplace and treat patients as consumers instead of treating healthcare as a human right that everybody should have access to no matter what. Clearly, your number one concern isn't for monetary matters, isn't for economic matters. It's not how much money are you putting in whose pockets. Clearly, your number one concern is the patients, right? Absolutely. Go fuck yourself, you out-of-touch Republican piece of shit. You poor-shaming Republican piece of shit. Oh, don't spend the money on the iPhone, poor people. Spend it on your health coverage. Be responsible consumers. You know, maybe if you were more responsible with your money, you wouldn't be poor. I mean, that's your fault too, right? So it's your fault that you're poor, and if you spend money on an iPhone instead of health coverage, well, not only are you poor, but you're irresponsible too, so that's also kind of your fault. Go fuck yourself forever. There's not a hell hot enough for you fucking people. And even if you don't buy the iPhone, it really doesn't make much of a fucking difference. That's also why I offer a hearty go fuck yourself to Representative Chaffetz, because even if you don't buy the iPhone, and you incur some serious medical expenses, or you're living on a low income, you're fucked. This issue is explored in this article in the Washington Post by Christopher Ingram, where he takes the example of a $769 iPhone 7 with a 5.5-inch screen, round that up to $800, so that'll be the cost of your iPhone. And then let's say that you have purchased a year of individual health coverage on the open market for a cost of about $393 a month, or a total of $4,617 a year. And let's say you're a relatively healthy person, you don't have to worry about deductibles, so all you have to pay per year on your health plan is that premium, which totals $46.17 a year. So you save $800 by not buying the iPhone, which means you only have to actually pay out of pocket $4,000, $3,900 roughly, for your healthcare premium. So that's good. You save $800 on your $4,700 healthcare bill if you get that plan and you are a healthy person who doesn't need to pay anything beyond your premium. If you're not such a healthy person and you do have to actually make use of some healthcare services over the year, like for instance, in the example given in this article, if you break your leg and you need to go to the hospital, you need to get lab work done, you need to take advantage of a lot of medical care because you have this unfortunate thing happen to you, then that could wind up costing you about $18,000 in total in premiums and out-of-pocket expenses over the span of about 2 years, because most people who get an iPhone don't get a new phone every year. They keep their phone for 2 years because you keep it until your contract expires and then you get a new one. So let's space out the healthcare costs and the iPhone costs over 2 years, according to Christopher Ingram. And he comes up with this, that if you find yourself in a situation like this, where you end up having to pay $18,000 over 2 years for health coverage, that's the cost of 23 new iPhones. So the good news is, if you're a person living on a low income and you were planning on buying 23 iPhones over the next 2 years, and you break your leg in a scenario like this one and you wind up owing $18,000 in health costs, don't worry about it. You just take that money that you were gonna spend on the 23 new iPhones, you just shift it over into your health savings account, and you're good. You're covered. If, unfortunately, you happen to be one of the people living on a low income who wasn't planning on buying 23 new iPhones over the next 2 years, and you find yourself owing $18,000 in health costs, I'm sorry, you're shit out of luck. You're fucked. And the thing is, the people behind this plan know you're fucked. Republicans know that poor people are fucked with this, and they don't care. They don't care about poor people. They don't care about women. They don't care about black folks. They don't care about Latinx folks. They don't care about LGBTQ plus folks. They don't care about immigrants. They don't care about people with disabilities. They don't care about people with mental health issues. They don't care about chronically sick people or people facing catastrophic health crises. They don't care about any of those people. And it goes beyond health care. Virtually every Republican proposal is something that will fuck people in one or many of those groups I just named. They know this. They don't care. The people who propose this health care plan know that people don't want it, that people don't like it, that people are horrified at the prospect of it, that even people who aren't crazy about the ACA think this is a terrible alternative that will make things so much worse. They know that the American Medical Association has come out against this plan. They know that numerous medical organizations and hospital organizations and patients advocates organizations have come out in recent days against this plan. They know all of this, and they don't care, because they don't care about you, and they don't care about me, and they don't care about anybody who could possibly need a government health care plan. The only people they care about are people who have enough money to not need any of this shit, to not have to worry about any of this. That's who they care about. And that includes people in their own party, because there are plenty of people in the Republican Party or who vote Republican who are trying to get by on a low income. Plenty of people. And they're going to be fucked just the same as the Democrats are going to be fucked, just the same as people are going to be fucked no matter who they vote for, no matter what party they're registered with, or if they're even registered with a party. Doesn't matter. Our party, their party, someone else's party. If you're poor, this plan fucks you. If you're poor and you're sick and you need medical care, this plan fucks you double. And Republicans know this, and they don't give a shit. They give a shit about them, and they give a shit about people like them. You think Donald Trump gives a fuck? You think Paul Ryan gives a fuck? You think Mitch McConnell gives a fuck? You think Jason Chaffetz gives a fuck about poor people who are going to be completely ruined by this or killed by this? You think they give a fuck? No, of course not. They don't give a fuck. They might say they do. They might give a very practiced answer on television and talk about how much they care about poor, suffering people, and they just want to give people more choices. They just want to get the government out of people's lives. They don't care. If they cared, they'd be doing something else. But they're not. They're doing this. And we shouldn't even call it Trumpcare. We should call it something that's a little more accurate, like Trump doesn't give a fuck. That's what we should call it. Because that's what it says. Hey folks, hope you found this one, I don't know, informative, cathartic, useful, worth watching in some way. If you did, please do like and share and subscribe to this channel if you're not subbed already. And also, please consider helping me to make more videos like this one by supporting this channel through Patreon. You can go to patreon.com/Steve Shives to become a patron of this channel. Thanks so much for watching, and I'll see you next time.